people think about diabetes care, a psychologist, like a dentist, isn't the sort of person that first pops into mind, which is interesting really, because diabetes is perhaps the most emotionally and behaviourally challenging of the chronic health conditions. It places enormous demands on people for lifelong management of a day-to-day self-care regimen that's often really intrusive into their normal lifestyle, and at the same time they're facing the ever-present risk of hypoglycemia, diabetic ketoacidosis, and long-term diabetes complications. So it's not surprising that people that have diabetes occasionally have some downtimes, which for the most part are quite short-lived, or a person can manage them on their own, or perhaps with the input of their GP or their diabetes educator. But sometimes people find that those downtimes persist for a longer period of time, and they need some extra specialised support or scaffolding to get through. And that's really where the role of the psychologist becomes important. That's where we can really add value in caring for people with diabetes. For people living with diabetes, mental health and physical health really go hand in hand. On the one hand, we know that diabetes has a huge impact on a person's emotional well-being. We see increased prevalence rates of depression. We also know that about 25% of people with diabetes experience very severe levels of diabetes-related distress. So diabetes exerts an enormous impact on people's emotional health. But at the same time, a person's emotional health also impacts on diabetes health outcomes. We know that when people are suffering from low mood or diabetes-related distress, they are less able to manage their self-care requirements, glycemic control is poorer, and they're also at increased risk of diabetes complications. So taking care of mental health in diabetes is really, really important for ensuring the best long-term health outcomes for people living with the condition. I guess you don't need to have a referral to see a psychologist, but if you want to claim the Medicare rebate, then you do need to have a referral from your GP. Now, psychologist services are rebatable under a number of different schemes, so it's a good idea to have a chat with your GP if you think that psychological advice might be something that you are going to benefit from. But if you want to see us as a private client, that's okay, and it may be that your private health insurance will cover the cost of the sessions that you have. So it's a good idea to check with your private health insurer as to whether or not psychological services are covered. But then I see people who just simply pay for the sessions themselves. So yes, services are rebatable. It's a good idea to chat with your GP because they're in the best position to know which rebate is going to be appropriate, and also talk to your private health insurer. Therapy is done in a very non-judgmental way as well, so I'm not going to tell you that what you're feeling or what you're thinking is right or wrong. That's not my job, and I think people really appreciate that as well. It's often the first time they've been able to speak their mind and not been judged. So in between visits to a psychologist, there are things that people can actually be doing to help them stay positive. Things like ensuring that they have a really supportive network of people around them. And when I say network, I'm referring to friends and family. And we know that people who get the highest life satisfaction are those that really invest in close, supportive relationships. But it's also important for people living with diabetes to have a good, solid network of health professionals that they can trust, and that they can trust to call on whenever they feel that they need help. It's really important that people think about setting some manageable, sensible goals for themselves. They may start off really small, but a lot of big, good things come from taking really small steps. So they're just some things that people can be doing. They're fairly easy to do in between seeing a psychologist and working on those issues that are causing them trouble.